The Minister of Water Resources and Sanitation, Joseph Utsev, has visited Maiduguri to assess the damage caused by the flood as a result of the collapse of Alau Dam. The minister assured that he will work assiduously to fix the damaged dam so as to avert future occurrence. The minister also visited the governor of the state, Babagana Zulum, and the Shehu of Borno, Abubakar Garuba Ekanemi, to commiserate with them over the disaster that affected more than 1 million people.
We actually sent our technical team, which have been on ground about 2 days back, and they're also going around assessing the situation. As we go back, we will have a detailed study of the situation and come up with preferable solutions that will give permanent solution to this particular problem. We are meant to understand that this happened in 1994, and it was not as devastating as this. So with this, we will make sure that from the Federal Ministry of Water Resources, in collaboration with the state government of Borno State, will work out a permanent solution.
Well, let's bring in a senior reporter, Jesse Taffy. He's standing by for updates on the flood situation. Jesse, the latest now is that the Alau Dam, which collapsed and caused this particular situation, is going to be fixed. What more can you tell us about that?
Thank you very much, Precious. Today is the 7th day of the flood incident that happened in Maiduguri, the Borno state capital, where thousands of homes were submerged, shops, markets, hospitals and other public places. Today, we could see that some humanitarian organization have launched a mobile clinic to cater the needs of the victims of the flood disasters. Now, we are at the Lake Church Research Institute. During the flood, this is one of the most affected areas, and you cannot access this place by any means. But today we can see that people are already here. It has become like an IDP camp for victims of the flooding, talking about those that are staying in Muna, those that are staying in 505. They are taking refuge here, and the humanitarian organization have brought this mobile clinic to them to cater their healthcare services, because the flood has destroyed over 10 healthcare facilities across the state. We can see a lot of doctors are here from the Borno state government and other humanitarian organizations. And we have one of the medical doctors here to talk to us more about this intervention. A very good afternoon to you, sir.
Good afternoon, Jesse.
Yes. Talk to us about this intervention today.
Today we are launching a free mobile clinic and health transport, and including online clinic. And this is as a result of the displacement that follows the devastating flood incidents in Borno State, particularly within Maiduguri and Jere, where we have densely populated communities that were displaced, over 1 million that were displaced here. And you can see that a lot of displaced persons are around us here. And why we chose this particular axis is because from Muna down to custom area, all the healthcare facilities were dislodged. And as such, we said, okay, let us mobilize the little that we can mobilize, all those people that can support us. And today we are here to actually launch the mobile clinic, but the health post has been there for the past 3 days. Ibrahim has been managing the health post very well, even though there are a lot of challenges. So today we came to support him. We also have another health post just close to this place that was also hosted, and they are right now consulting patients. So after the displacement as a result of the flood, we have this humanitarian situation right now. And then we realize that issues that is related to wash, that is water, sanitation and hygiene, is one of the things that we should focus on. And then also issues of nutrition, because many people were displaced from their livelihood. A lot of them came with the single clothes that they are wearing. Apart from that, they don't have any of their belongings. They lost almost everything. Then issues that has to do with shelter is another thing that we should also advocate for. So, and then health issues, because right now we are having a lot of diarrheal diseases, vomiting and diarrhea. And many of them are also coming off with even hypoglycemia, that they don't have enough glucose in their blood and they have been fainting. And we also witness a lot of cases of malaria, because you know the place has already become waterlogged, and it is actually a breeding area for mosquitoes. As you can see around everywhere, there is water that is actually that is there, stagnant water all over. And they also have shortage of water. So whenever there is shortage of water, and then people are not getting enough potable drinking water, so it becomes a problem. So this is the crisis that we are facing right now. And then we said, okay, let's mobilize ourselves and come together to see, in a united force, to see how we can listen. And a lot of people donated massively. As you can see behind, you can see the display of drugs. We also have similar in the other health posts. Perhaps if we leave this place, we can also go and witness what is happening there.
Thank you very much. Thank you very much for your time. This is Dr. Abakaza. He's one of the medical doctors here. And another thing of concern today when we were coming to this place is that there are a lot of places that are still waterlogged. We can see that people are trying to get out from their homes. They're trying to scavenge what it is remained in their houses. We spoke to some of them and they said virtually everything was lost inside the waters. And a developing story we're getting moments before now is that there are those places whereby the waters have receded and people from camps are now coming out to their homes, and the state government have started giving out food palliatives for them and some cash to help them go back to their homes. But the state government also said even if they're back to their houses, they would be going to check on them and to check the level of severity of the damage of their homes so that they would be supported. And one thing to note is that if you're going back to your house and if your house is not too strong, the government will not allow you to stay in the house. They would have to reconstruct the house for you so that it doesn't collapse when you're there. Precious.
Very interesting development in terms of the intervention of the state government in this situation. Thank you so much, Jesse, for the update on what's going on in Maiduguri. We're back here in Lagos, where residents of Ayetoro and Okobaba communities have reported